First metatarsal phalangeal joint.
You have them flex in, extend their toe so you can find the joint line. This will be right there.
First metatarsal bone.
That one will be right here.
First cuneiform bone.
Right there.
Navicular bone.
It's on the inside right here.
Talar head.
That one's right there.
Calcaneus.
That's the heel bone down here.
Sustentaculum tali.
That one's right in here.
Spring ligament.
Right there. Spring ligament goes from that to the navicular bone right here.
Tibialis posterior tendon.
That one comes right down through here and inserts at the navicular bone.
Flexor digitorum longus muscle.
It's on the bottom right here and comes up to the little toes.
Flexor hallucis longus tendon.
That one's right here.
Medial calcaneal tubercle.
Right there.
Plantar fascia.
That's just on the bottom right here.
Sesamoid bones.
Those are right up in here, but they're a little bit different on everybody's feet.
Fifth metatarsal bone.
That's right here.
Cuboid bone.
It's just above it right in here.
Peroneal tubercle.
It's right there.
Peroneus brevis tendon.
So that one comes down through here and inserts on the fifth metatarsal.
Peroneus longus tendon.
That one comes the same way, but comes underneath the foot and inserts on the first metatarsal.
Second and third cuneiform.
That's right there, second and third.
Dome of talus.
That's right in here.
Sinus tarsi.
It's on the lateral side, this little indent right here in the foot.
Extensor digitorum brevis muscle.
That's this one right here that you can kind of see a little bit.
Tibialis anterior tendon.
That one's right here. And then,
Extensor hallucis
wait.
longus.
And then, oh, that inserts on the first cuneiform right here, I think.
Extensor hallucis longus tendon.
Right here.
Extensor digitorum longus tendon.
One's right here, connects to the little toes.
Peroneus tertius.
That one comes down through here and then inserts on the fifth metatarsal.
And that is all for palpation.
So next would be active range of motion. So you have them bend their toes so you can find the MTP joint again. And then you line the fulcrum up with that, and then the stationary arm goes straight back along the foot. Then first I'll have her flex her big toe. And that's at about 46, which is in the normal range of 45 to 55. And I'll have her extend, which is at about 78 or 9, which is in the normal range of 75 to 85 degrees. And then you would do passive range of motion. So you would hold right here to stabilize the foot. And then you can bend it, you can flex it and extend it to find the end feel. And then you could do that with any toe. And then next you do manual muscle testing. So you want to hold just below the joint you're testing. And then you push against, so flex, then extend. And you can do the same thing for all the little toes. Flex and extend. Just got nice strong toes. testing, we'll do special tests. So the first one is valgus. So you want to hold just down here. And for this one, you want to move it laterally. And then if there's pain or increased laxity with that, that indicates a sprain of the MCL ligament. And then for the varus, you would go opposite and go medially. And if there's pain or increased laxity with that one, it indicates a sprain of the LCL of that joint. And then next is the intermetatarsal glide test. So for this one, you want to hold the two metatarsals on either side of the joint you want to test. And then you move both of them planarly and dorsally. And if there's pain or laxity with that, that indicates trauma to the deep ligament in that joint. And then for the tarsometatarsal, you do the same thing, but this time you only move the one joint or the one bone involved. So I'll just do this one. And if there's pain or increased laxity with that, laxity would indicate, or if it like moves more, that indicates that there's laxity within that ligament. And if it's decreased, then that would indicate a joint adhesion. And then for the mid-tarsal, you would come down here to the tarsals of whatever joint you want to test. And then you do the same thing as the tarsometatarsal, so you'd only move the one tarsal involved. And then same thing, if it could indicate increased laxity or joint adhesions. And then next you do navicular drop test. So this one, you'd have them have their foot hang off the end of the table, take a piece of paper, and then line it up with the bottom of their foot. And you draw a line to where the navicular bone is. And then you'd have them put their foot off the other side and put full weight on it. And then you want to do the same thing. Find the navicular, draw a line, and then if the navicular bone drops more than 10 millimeters, that indicates a hyperpronated foot. Next would be Tinel sign. So for this one, just want to go to the medial side of the foot, right here where the posterior tibial nerve runs. You just take like 2-3 fingers and you tap. If there's pain or paresthesia, that indicates entrapment of the posterior tibial nerve, or tarsal Tinel syndrome. And then next you would go to long bone compression. So you take the distal and proximal end. So for this one, I'll do the first metatarsal. And then you would squeeze in towards each other. And if there's pain with that, that indicates a fracture at the site of the pain in the bone you tested. And then the last one would be interdigital neuroma tests. For this one, it's usually between the third and fourth metatarsal. So for this one, you just hold on either side and squeeze together for about 1 to 2 minutes. And if there's pain with that, that's decreased when you release it. That indicates interdigital neuroma, that joint. So next you need to find the pulse. So the first one would be dorsal pedis pulse. So that one would be right about in here. Right there. And then the second one is posterior tibial pulse. So you go back here. And it's right there. So next is dermatome and myotome testing. So for L4, it'd be like up through here, and you cross the patella tendon down to the big toe. And then for the dermatome testing, you would test like a sharp end and a dull end right here. Have them tell you which one it is. And then for L5, you'd want to go up here, across the patella again, down through here, and in between the first and second toe. And then that one's dermatome testing. You just do the same thing, sharp and dull right here, and have them tell you which one it is. Oh, I didn't do mine. I'll just do that last. S1 would be like lateral side of the gastrocnemius to like the 5th metatarsal, I think. And then for that one, do the same thing over here, sharp, dull. S2 for dermatome testing would be back of the leg, like down like the middle of the gastrocnemius to the Achilles and touch at the bottom of the heel. So that one you would just do dermatome testing right here, sharp, dull. And I forgot to do myotome, so we're gonna go back and do that. L4 would be ankle dorsiflexion. So I would push down, have her push up against me, and then L5 is big toe extension. So I have her push up, and then S1 was ankle plantar flexion. So I'd push up, have her push down, and then for the last one, for S2, be knee flexion. So I'd have her hang her foot off the edge of the table and then flex against me, and then I'd pull. And then last is reflex testing, right? So we come over here. The first one is quadricep reflex test. So you want to go right on the patella tendon right in here. Just tap a few times. Might take a couple tries to find it. Okay, right there. And then the second one was on the Achilles. So you'd have her go here. This one's kind of hard to find, so it's right on the Achilles tendon. Might have to tap right there. All right, that's my video.